Real questions, real answers for real life. Come on in and pull up a chair. You're at 1850 Main Street with Michael DelGiorno and David Zanotti.
What got broken during COVID? And is it still broken today?
So my question for you is this. Why do we have so many permanent, impactful changes over something that was temporary at best, unnecessary at worst, in terms of control and lockdown? And there's several stories that bring this to light. Marco Rubio just did a 40-page piece report on the crisis of non-working men in America today. I'm never a huge fan of David Leinhart, but he did have a really good one this week where he was covering school attendance. In fact, quite eloquently, Dave, listen to how he writes this. If you're a child or a former child, you know how hard it can be to summon the energy to leave the house each day for school. It's early in the morning, you're tired, maybe you have a test, maybe you have a social situation making you anxious. Staying in bed often seems easier. For as long as schools have existed, so have these struggles. Nonetheless, children overcame them almost every day, sometimes with strong nudges from their parents. Going to school was a normal thing to do. And then suddenly it wasn't, the COVID pandemic. And then he goes on to talk about on an average day last year, in the school year of 2022 and 2023, close to 10% of K through 12 students were not there on any given day. We also have an Air Canada story, which shows the control is still alive and well for those that will be controlled or live in fear. And then the Fauci re-bringing up the masks, and it makes you wonder if they would play the lockdown card. And all these stories, I know talk radio will pick one or two maybe and do them, but I think the underlying real question is why so much, whether it's the airlines, whether it's a restaurant you visit and there's no staff, whether it's school attendance or the social ongoing impact of the lockdown, why so much permanent change for such a temporary, if not unnecessary, occurrence? And yet, I think the first question becomes, and no one even asks the question. Nobody even really discusses it openly.
No, you can't do that. You can't say, here's the question. Then I've got to go back and say, but the question before the question.
No, but you know what I mean? You know what I mean? It's like the more you ask, but the problem is I can't stop asking questions and no one else is asking any of them.
So let's just jump in on one of them. Let's take the Fauci thing. Michael, you can imagine, because we walked through COVID together. In fact, we walked through it with a number of friends, a number of associates at the American Policy Roundtable.
Dr. McGowan.
Square, Raiderberg. I was just with Dr. Chuck. He says hello. We had a chance to talk with Dr. Chuck about his new book called A 75-Year Journey. He talks about from the time he was a kid, deciding he wanted to become a doctor, to the time he became a doctor, to this day where he still does serve at a medical clinic for underprivileged families and low-income households in Northeast Ohio. He's still in the game. He's still in the business in his 80s.
But all of our curiosities
all the changes that he's seen.
Yeah, but all of our curiosities, all of our suspicions would have just remained that without Dr. McGowan. He's the one that gave us the medical fact to kind of fuel our courage, that we knew in discernment something was really wrong.
And I think it's important to plant this, to retell this to each other, because when the whole COVID thing was coming at us, we had all of our spidey senses were going off saying something here is bad. This isn't right. This doesn't make sense. And so, of course, I call Dr. Chuck and we start talking, and he starts giving me Virology 101 and trying to explain to me what reality is here and what the overreaction is. Now, he's a medical professor as well. He's an Air Force flight surgeon. I mean, he's an incredibly accomplished man, but I've known him for 50 years. He's never told a lie to me, ever. When he thought he had something right and he had it wrong, we've always talked about it, but we've testified before committees in government, but together we've written papers and written treatises. We've done all kinds of stuff together. Plus, I've been in his home when he was a hotshot young doctor outside of Youngstown, Ohio, and tall, handsome, well-to-do, lovely home, Dr. Marcus Welby type guy, and he found faith, and his whole life changed around. And so, I mean, I know this guy. And so we talked about it. Then I got a call back from Dr. Chuck very shortly after that saying, newsflash, we just had the first case of COVID in our section of Ohio. We had number one case came through our clinic today. Oh, great. and it was one of my patients. Oh, did you see him? No, a PA saw him, but he came by my doorway. And according to all the responsibilities that we have on quarantining, I will be the first doctor in our area to also go into quarantine. So we'll be talking by phone for the next 10 days because bye-bye. So I'm going to go and do my research, and we'll be talking from my office. I won't be able to talk to you here at the clinic. So he was the first. And at that minute, as soon as I got off the phone, I went to our team at the Public Square Media Network. I said, stop the presses. This will be the story we will carry every single day until we find out what happens, because we have the leading edge on this story. And so Dr. McGowan walked us personal experience through COVID.
And because up until that moment, it was an Italy story. It was a China story.
Exactly right. You are exactly right.
And at that time, by the way, the Fauci narrative, and same for Nancy Pelosi when it came to the Super Bowl in California, the narrative was, it's just a cold. It probably won't get here. And by the time it gets here, it'll be getting hot and it'll burn off. All the things later that they only hold Trump accountable for saying, they said first. But now keep in mind, all we knew was that. Now, I can tell you this, I am not a doctor, nor do I play one, though I am married to a hypochondriac, which makes me very, very smart when it comes to medical things. So what is Virology 101? There's a virus. Mm-hmm. It spreads. You don't defeat it. You just get immunity, herd immunity. Now,
you outlive it.
You outlive it. And you remember how everybody used to say, oh, all right, well, let's start with you with herd immunity, which was such a childish notion.
But the irony is when they would say that, but they wouldn't even think through the logic that that's exactly what they were doing to every first responder in the hospital systems and in every doctor's office. They said to every one of them, you try it, because remember, we didn't have any, quote, vaccines at the time. Now, we could go back and rehearse the COVID Chronicles, which for us turned into 25 episodes of broadcast and YouTube features that we did. And for you and I working together in broadcast radio, heaven knows how many times we were together talking about this. And I can tell you it was one of the most rewarding experiences when we finally got out of it. How many people wrote to us and said, your conversations with Dr. Chuck kept us sane. We had grounding. We could walk through this. And by the way, yes, you were right. And he was right.
Yeah, he was. Well, because science is right. But it didn't take long. We went kind of through two big waves, two real dividing waves. One was over vaccines and the other was over masks. Vaccines far more contentious because it cost people jobs. But it wasn't long before I came to the conclusion in my spirit, beyond all my research, which really began at the University of Washington, because these...
Yeah, for you. Yep.
Yeah, because it...
And I was at Ohio State University. May I interrupt?
Yeah, go ahead.
We also were monitoring this from the State House in Nashville, the State House in Columbus, the State House in Florida, and Capitol Hill. So we had 4 critical marker points where we were monitoring what government was doing every single day. And in all 4 cases, they were different.
Why? Because the narrative was, this one's different. The death rate is different. Really? So then you go to and it's all based on this University of Washington study that doesn't have data because COVID was just getting here. So when they don't have data, they put in assumptions. So all I wanted to do was go to the University of Washington website, look up this COVID study, and see what the assumptions are that they put in. By the way, they never would tell you the assumptions. Fauci never really came clean about the assumptions that they were using. They just came up with this death rate figure to increase fear to the point where it came to, David, and you know this more than anything, with everything scrolling on television. The narrative was, if you go outside, if you don't listen to government, if you don't trust government, you will get COVID. And if you get COVID, you will die. And we're like, well, wait a minute. No, you won't. And then you start doing the opposite of smart things, right? So you start masking healthy people. You start sheltering in place healthy people. You lock down and close schools. That's where your most healthy herd immunity can come from. I mean, we could go on and on and on.
You shut down Disney World.
Well, yeah.
And send a message to the whole world that America now is officially out of business.
Out of business. Well, and then what you ultimately stated in all of our broadcast adventures was, somebody thinks you can turn an economy off like a light switch and it'll turn right back on. We're having this discussion today, you and me, because it hasn't switched back on yet.
That brings us full circle back.
But now, let me just make one last point. How long
Sure.
was it before you and I both came to the conclusion, and then I coined the phrase that you loved? COVID has revealed way more than it did. That really would, and we quickly realized that Americans were very fearful because of ignorance, and ignorance is bliss till consequence arrives, and very dependent on government. And they bought the controlling lie that only the government could keep you safe. Trust the government. And I think in the long run, that much we still haven't necessarily completely healed from. But yeah, that full circle. Let's start the conversation.
That's the great platform for the next piece. So now let's visit Fauci pictured in online articles with putting a mask on and basically making the story that there's a new variant out there. It's coming to get you. And don't be surprised if masks come back because this new variant is risky and dangerous. And then he closes his remarks by saying, now, the CDC doesn't issue regulations. It issues guidelines. And in a famous Fauciism, he said, I hope when people see the guidelines on masking returning, they will abide by the guidelines. They will abide. Man, I had chills run up and down my spine. My eyes started hurting when I heard that. I can't tell you the number of painful stories. You know, Michael, that our phones never stop ringing. Business people in multiple states who were losing everything. Of decisions that people had to make. There was a point in time when my wife and I were traveling between the three offices of the Roundtable, between Tennessee, Ohio, and Florida. We literally had to have alternate routes to get across the border so we would not be locked down.
Oh, remember when I came to visit you? I couldn't believe
Oh my gosh, do you remember that
It was a
trip?
different world from Tennessee. And I was just trying to go to the bathroom, and oh my, I felt like I was.
We were at one exit on I-71
was like Red
in
Dawn,
Ohio,
too.
outside Columbus. Yeah, and there were no bathrooms. There were no open bathrooms in restaurants, in Starbucks, in gas stations. There were no restrooms.
Yeah,
Nowhere.
I thought of two things when my reaction to Fauci was first the Joe Vigism. You're insulting me and you're embarrassing yourself. That would be the.
I'm glad we got that on 1850 Main Street. Say that again slowly. It's one of our favorite Joe Vig statements.
Joe Vig would always say, if you say something really, now you're embarrassing yourself and you're insulting me. It was like it sounds better in Joe Vig's voice, but I like to do it like Groucho Marx. Now you're embarrassing yourself and insulting me. So that should be America's response. But then my next thought was, well, shame me once, or fool me once, shame on me. Fool me twice, shame on you. I hope America arrives at this, because what became very obvious to me is Fauci, who's supposedly gone, has never faced any kind of justice for the lies he's been caught in. Mm-hmm. But this isn't 4 years ago now. We know the results of masking. We know the results of lockdowns. Are you going to pull a Vince Lombardi? You're just going to do the toss sweep till somebody stops you? Would they actually call this play again? And would America in fear and dependence follow again?
So this brings us again in another full circle to the first premise of the question. What got broke during COVID? And there are things that are recovering. The economy is still in desperate straits, but that's
policy driven too.
Yeah, that's that. And yes, policy driven without a doubt, because not only did the current administration extend the stupidity of the COVID lockdowns, regulations, and all that other nonsense, but then they piled on with their Green New Deal
spending
energy situation, collapsed us, and then spawned unprecedented inflation. I talked to somebody today who said a family of four, and they would go to Costco once a month to make like the run. Everybody that does one of those big runs. And he said that as a family of four, we'd save up, and there was one time each month we'd go to Costco, and the bill was $500 because we were getting all the stuff that a household needs. And he said went and did that run just last night, $732 for the exact same cart. Now,
yeah, I don't have to tell you what feeding a family of five has been like, and it's like it's the missing thousands in everyone's bank account.
And now, a message from your captain.
Remember, the flight attendants are primarily here for your safety. After that, they're here to make the flight more enjoyable. They're going to take care of you guys, but you will listen to what they have to say because they represent my will in the cockpit or in the cabin. and my will is what matters. Be nice to each other, be respectful of each other. I shouldn't have to say that. People should treat people the way you want to be treated, but I have to say it every single flight because people don't. They're selfish and rude, and we won't have it. Okay? Do your stuff. Get it out everybody else's way. Put your junk where it belongs. Everybody a pig for a space. Don't lean on other people. Don't fall asleep on other people. Don't pass out on other people or drool on them unless you've talked about it. All right, a little bit of fatherhood here. The other thing. The social experiment on listening to videos on speaker mode and talking on a cell phone on speaker mode, that is over and done in this country. Nobody wants to hear your video. I know you think it's super sweet. It probably is. But it's your business, right? So keep it to yourself. Use your AirPods, use your headphones, whatever it is. That's your business, okay? It's just part of being in a respectful society. Middle seaters, I know it stinks to be in the middle. Raise your hand. Raise them up. Anybody in the middle? Like 5 people. Yeah, right. That's full. All right, nobody's listening. Fine. You own both armrests. That is my gift to you.
We hope you enjoy your flight.
So let's go back to what got broke. We've determined when it got broke. It got broke at COVID. What got broke? I'm going to throw up a simple word. Trust.
It's a good one.
The government lied to us. Friends in government lied to us. One governor I know had a great amount of trust among the small business community in the Midwest. And Mike DeWine, the governor of Ohio, started off saying to business people, give me 2 weeks. I'm only asking you for 2 weeks. We'll get this thing figured out. I had a number of business people call me and say, should we trust him? I said, absolutely not. Why? Mike DeWine's a friend of yours. He's been a friend of yours for a long, long time. He's a fine man. And yes, he has been a friend, but he's got his head up his tail end on this one. His research is bad. He doesn't know what he's talking about. His advisors are wrong. He's not listening to Dr. Chuck McGowan or to anybody else that makes any sense. And if you give him 2 weeks, he'll take 2 months. He might take 2 years. That's what I told him. Now, you know what those business guys did? They gave him 2 weeks. Every one of them knows now it was the first critical mistake. They should never, ever, 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 ever have complied or abided by this phony regulation. And what I showed to them was I showed them the models that the governor was using from Ohio State University. We retro-engineered those models. We literally took the pictures of the models and the data, tore them apart, rebuilt them with forensic entomologists, people that understand how all this stuff works. And we basically rebuilt their models out and said, these models are built on absolute nonsense. They make no sense whatsoever. You can't do this. You absolutely can't do it. So what ended up happening? They don't trust the state government anymore. Something's been broken. And it's not going to be repaired until somebody comes forward and says, we made a terrible mistake. It was the wrong thing to do. You know where else trust was broken? It was broken. It was already eroding dramatically because of the opioid crisis and because of Purdue Pharma. But trust was broken with Big Pharma forever.
Well, I wouldn't limit it to that. In fact, when you say trust, I think first of the doctors closest to me. When I saw them just like sheeple,
fold like cheap chairs in a funeral parlor.
And here I am. This is medical doctors that I am trusting to keep me alive and healthy.
Yeah.
And now I realize, oh my gosh, they're just following a protocol or following what's edicted down to them. I know more about COVID than they do. That's a trust that hasn't been rebuilt. So I say Big Pharma.
Michael, right after that, the hospital system.
The hospital system.
And here's how the hospital systems lost trust. At first, hospitals were heroes because they were the first responders. They were willing to take it on the chin because of their professional, ethical, moral commitments to healthcare. Thanks be to God. They were the first heroes in this process. And then when they had survived and built all their personal immunities and they were overcoming this thing at the first responders, then suddenly everybody got the bright-eyed idea that the vaccine was the super answer. And the people that had braved their own lives in the era of uncertainty and had overcome, they got fired because they wouldn't take the vaccines. And thousands of healthcare workers in communities and hospital systems were fired, trained, educated, practicing, heroic people. And you know what? When they left, they didn't come back.
No. And by the way, may I add to this, there was a little invasion of the body snatchers, not to be overly dramatic, in the air. That, at first they were heroes, and that was the narrative. Thank them. They're heroes. Kind of like police were heroes and firefighters were heroes after 9/11. And then we all know what Antifa and Black Lives Matter turned our heroes into. But there was like an invasion of the body snatchers. So first all these nurses and doctors are heroes, and then if they didn't take the vaccine, there's invasion of the body snatchers and showing them the door.
Yeah.
It was really surreal and bizarre.
They're insurrectionists all of a sudden. They're rebels against the system. It was like exactly right. It was like a very freaky, cheap horror movie.
Oh, it really was. All right, so broken trust with the federal government, broken trust with the state government, broken trust with education and school boards, doctors, medical personnel, and hospitals and big pharma. How about corporate America and the way they piled on selling the narratives in commercials? It was like it was all scripted. Stay home, stay safe. And Visa knew it and everybody else knew it. And they were all promoting it. Nike was promoting it. There's one last one. And this one really falls under the fear, what COVID revealed. And that is America's inability to trust each other. It turned us against each other. And suddenly America was masked America and refusing to mask, selfish, jeopardizing, or intelligent and studied. But it turned them against each other. Masked versus unmasked, vaxxed versus unvaxxed. And that played right into the weakness of the social dilemma. And I think that is probably where the healing needs to begin first. If you talked about a cut in skin, at what level does it need to start healing? And I don't think that one ever can heal. Now, you could talk about America's broken trust after Kennedy was killed, and it took decades to repair. When you start having broken trust at the federal level, the state level, the medical level, the education level, each other level, where does this begin to heal?
That is a very fair question, and I need another cup of coffee. We got to come back.
No, we can't. Don't make me wait. All right, two Splendas.
The conversations are just getting started. To get connected, check out 1850mainstreet.com. We don't data mine anyone or sell your information. Subscribe today so you don't miss a single conversation. We'll see you next time here at 1850 Main Street.